Stakeholders in the health, climate and urban development sectors want stronger collaboration to address the growing impact of extreme heat on public health in Lagos. The call is coming at a workshop where participants stressed the need for coordinated action to tackle climate-related health challenges in rapidly growing urban communities. We have details in Jamiu Shunubi's report.
In Lagos, rapid urbanization, population growth, and the expansion of built-up areas have intensified the urban heat effect, exposing residents to higher temperatures and increasing the risk of heat-related illnesses. These challenges further highlight the need for sustainable urban planning and climate-responsive public health policies.
The heat we're having now is becoming so extreme that even in the regions where heat was not common, we now hear of serious heat.
In terms of heat effects in health, for example, these effects can accumulate a lot, leading to potential non-communicable diseases or aggravating conditions that are already happening. The problem is that this kind of effects are not immediately seen. There has to be an awareness that heat is part of those conditions. They're not isolated.
Actually, what we're seeing with climate change is increased frequency of extreme heat waves. Now, this is not just, it's just a little bit hot. In fact, there is a connection between extreme heat wave exposure and some of the diseases that we're seeing going up and up and up in cities like Lagos.
The workshop, led by Professor Tolula Oni, emphasizes the importance of stronger collaboration among government agencies, researchers, development partners, and local communities to develop evidence-based interventions that will enhance climate resilience and protect vulnerable populations.
We don't see how it's actually impacting the health of people. And this is where data becomes really important. So we can experience it and we know that it was really hot. But what we can't see is, what did that do in terms of hospital admissions? What did that do in terms of premature deaths? And particularly in the most vulnerable, under 5-year-olds. We also know it increases the economic burden because it reduces productivity.
We've had our strategic transport master plan, and we renew it every 2 years, just to make sure that we have a defined public transport network with good buses. There are already plans to move away from fossil fuel sources like diesel and petrol to electric buses and things like that, just to have a cleaner air and all.
Human beings were the weakest in the ecosystem. So the plants can do without us. The animals can do without us. We cannot do without nature. Do you understand? The same thing, this issue of health and others. The realities are sufficient to make people take action, because non-action is going to be detrimental to themselves and, of course, to the society at large.
Participants reaffirmed the need for sustained collaboration, increased public awareness, and policies that integrate climate action with public health planning, expressing optimism that a coordinated approach will help reduce the impact of extreme heat and build a safer, healthier, and more resilient Lagos.